Good morning. Thank you for waiting. We will go ahead and get started. We do still have people coming in through the waiting room, but we'll go ahead and get going because we do want to make the most of our time together. So again, this is Anna Davis. I am the Hospital Staffing and Acute Care Regulation Manager, and I am here with.
I'm Kimberly Volker. I am the Interim Survey and Certification Manager. Good morning, everyone. I will say for this morning, please do go ahead and send your questions directly to Tip McIntosh. She is a member of our team who is helping us out with questions today. And so she's going to help us get to them as Anna and I answer questions.
And with that said, we're going to go ahead and launch into this webinar all about hospital staffing complaints. And just a reminder, if you aren't able to stay for the whole thing, we will put a copy of this recording onto our website, and we'll also put the slides up there. And we have some information to present at the beginning, and then we will start answering questions you've been submitting all along. And keep submitting the questions as we go. We'll get to them after we get through our slides. So the first thing I did want to highlight is on our website, which is healthoregon.org/nurse staffing, we now have a dashboard that we update every 2 weeks. So you can see where we are in terms of complaints. And this is the latest update to the dashboard that was on July 29th. And that shows that prior to June 1, we had 280 complaints, and since then, from June 1 until July 29th, we got an additional 1,193 complaints. As of July 29th, we had 289 complaints under investigation, so open investigations occurring at that time. We had completed 70 investigations by that date, 61% of which were completed within 80 days of the investigation start date. And of those 70 complaints, 27 resulted in a proven non-compliance incident. So there was a violation proven in 39% of our investigations. And I do want to just highlight that that's up on our website. You can check it anytime and you can see what our latest numbers are. So the things we're going to cover today: what is a valid complaint? How does the complaint process work? How do you submit meal and break complaints? And then some tips for success when submitting hospital staffing complaints. So what are valid complaints? Under the hospital staffing law, OHA can only investigate valid complaints, and the law defines what a valid complaint is. It says it has to be submitted within 60 days of the alleged violation, so within 60 days of the underlying incident, and it has to contain allegations that, if assumed to be true, would constitute a violation of a provision listed in ORS 441792, and I'll jump into what that is. But I do want to highlight that because the nurse staffing law includes a whole lot of requirements, but the only ones we can investigate and enforce are the ones listed in 441792. So, what are valid complaints right now today? Currently, we are investigating complaints related to failure to adopt a nurse staffing plan, failure to comply with the staffing levels in the nurse staffing plan, failure to release a nurse staffing committee member to attend a nurse staffing committee meeting, and requiring a nursing staff member to work mandatory overtime. And there are a couple exceptions in the law for when it might be mandatory overtime of less than an hour that would be permitted versus mandatory overtime that is not permitted. And I do want to note that we investigate complaints for the time frame of September 1, 2023, when the new law took effect, through May 31st of this year, using the plans in place at the time. Those were likely approved by the staffing committee under the old law. So that was old plans, new law. We expect that investigations of incidents that occur after June 1 of this year relate to plans that were adopted after September 1 of 2023. So that's new plans, new law.
And Anna, too, to expand on that too, that's to some extent, that's also part of our process with investigations. I'm sure we'll get into that a little bit more, but right now it's August 9th. And if someone had a complaint about a violation on July 2nd, for example, and let's say the plan changed on July 5th, we'd still look at the July 2nd plan because that was the plan in place at the complaint time of the
Exactly.
complaint.
So I want to jump into what complaints are going to be valid later. These are complaints we can't currently investigate because there are some additional parts of the law that take effect on December 31st of this year. So after that, we'll be able to investigate complaints of failure to establish a hospital professional technical staffing committee or a service staffing committee, failure to create a professional technical staffing plan or a service staffing plan, failure to comply with the staffing level in that professional technical staffing plan or in the service staffing plan, including CNAs that are covered in a service staffing plan, or failure to release a professional technical staffing committee member or service staffing committee member to attend their respective staffing committee meetings.
And just also real quickly, as it relates to those CNAs, we are currently doing investigations for CNAs that are incorporated into a nurse staffing plan. This slide is really for those CNAs who might be incorporated into a service staffing plan.
Right, so if your nurse staffing plan currently includes minimum staffing for CNAs or maximum patient assignments, then we can investigate that. But if there's nothing in the nurse staffing plan about CNA levels, then we wouldn't be able to enforce it. Okay, the complaint process. So complaints are submitted through the hospital staffing online complaint form. It's linked in two different places, both on healthoregon.org/nurse staffing and healthoregon.org/facility complaints. And in both places, it's the blue button. The blue button is that hospital staffing complaint intake form. And the green button's where we now have an issue. That is the link directly to BOLI's online complaint form. And the OHA just updated their logo on Tuesday of this week and changed that green button, so it's kind of turquoise now. If you hover over it, it turns green, but if you don't hover over it, it looks turquoise. We may change the color of it to create a little bit more contrast because that's the BOLI complaint, that's meals and breaks, versus the hospital staffing complaint.
Yeah, it definitely looks blue and teal. That teal / turquoise / green button, whatever color it ends up being, it still links to the same place. It still links to the BOLI Complaint Resolution Center. You'll notice that, like Anna said, there's a little less contrast between the two, but it goes to the same place and it goes to the right place.
And I just took a screenshot. This is the first page of that. When you click on that blue button to go to the hospital staffing complaint form, this is what you'll see at the very beginning of that form. And it does have a link if you wanted to file a patient safety complaint about a specific patient impact, that there's a link to that. But this form has the questions we need you to answer if you want to file a staffing complaint.
And for those patient safety, it really is about a specific patient. So their name, their date of birth, the dates they were there, what went wrong for them specifically. So that's something that is more common to see through patients or their family members. Of course, hospital staff are welcome to file complaints if they have one about a specific patient, but it's not broad impacts. It's really specific individuals.
And if you file that patient safety complaint, we will actually be investigating not the hospital staffing of it, but did the patient care comply with the requirements of Medicare, Medicaid, and state patient safety laws? Okay, so this is just a quick flow chart of the complaint process. When we get a complaint that's filed online, then it goes in through our triage where we figure out, is it a valid complaint or not? So is it within 60 days? And one of those listed types of issues that we are permitted to investigate. And you'll see follow-up. We'll talk about that a little bit. Then if it is a valid complaint, it goes into investigation. Then we generate a report, and then there is an enforcement process. And I'll talk a little bit about what the enforcement process looks like now versus what it will look like in starting in June of 2025, because there's a pretty significant difference. So a complainant, a nursing staff member or an exclusive representative, completes the complaint form and sees the following confirmation in the online complaint system that the complaint has been submitted. So you see this is confirmation that your hospital staffing complaint has been submitted to OHA. So that is when you submit a complaint, that's how you know we've gotten your complaint. We then take that complaint, we enter that complaint into our database. We use a federal database, and we review the information you've provided to determine, is it a valid complaint? Is it within 60 days? Is it one of those issues we can investigate? We send any follow-up questions that are necessary to determine validity. But the form should be it's pretty easy. If you answer the questions on the form, we're generally, with some specific exceptions that we'll talk about in tips and tricks, we are generally able to see, is it valid or not? And within 14 days, we send a copy of that complaint to the union if there is a union at that hospital, whether or not that individual is represented or a member of that union. Within 30 days of determining that the complaint is valid, we start an investigation, and that begins with an official notice of investigation that the statute tells us what we're going to put in there and who we're going to notify. We notify the hospital administrator, the staffing committee co-chairs, and in nurse staffing investigations, the chief nursing officer. And we also send a copy of that to the exclusive rep. So again, to that union representative, if there is a union at that hospital. And that notice of investigation provides the basic summary of the complaint. It does not provide the complainant identity. It is not permitted to include the date or shift or unit, but we can include in that notice the week in which the alleged non-compliance occurred. We also send a needs list that includes some more specific information so that we can get the records we need to start that investigation, because hospitals have a whole lot of records that they generate, and we need ones that are very specific. This unit, this shift, this day. And so that's the sort of information on our needs list. In addition, our needs list asks for things like the staffing plan in use in that unit at the time of the alleged non-compliance, because staffing plans get updated over time. If we get a complaint that says this occurred in June, we need the staffing plan that was in place in June, not the one you passed last week. Within 20, and we also offer hospitals an entrance conference at the beginning of that investigation. It's less than a half an hour. It's usually 10 to 15 minutes, and we're available to answer questions about the investigation process. It isn't an interview. We aren't asking questions or gathering information. We're just providing, again, the needs list, and we can answer any questions about what the investigation process looks like, what the timelines are. We've had questions about whether we're actually doing investigations at this time. It's a good time to ask that question.
Less now. Happened a lot in September, but a little less of that now. And I would say, truly, it's really about us making sure that we explain what that process is going to look like, so that people know, okay, yes, we need to get the documents to this location so OHA can look at them. We'll give details on how to, for example, upload to a secure portal, that sort of information. And so we need the names and contact information of the few individuals at the hospital who we're going to grant access to. And we usually ask for no more than 5, just because it can be a bit of a process getting people to have access. But that, like you're saying, Anna, it's really not an interview. It's a, please let us know the contact information, and these are the timelines of when we need the documents, and here's the documents we need.
And so within 20 days of the start of the investigation, the hospital needs to provide the requested records. That's the nurse staffing plan, any staffing assignments, timesheets, all sorts of those documents, so that we can then review those records and determine whether there is information that can prove or disprove non-compliance. In our investigation, we review those records, we request additional information as needed, we conduct interviews as needed, and I will say interviews are often asking for confirmation of what we see in the written records, or asking hospital staff to point where in the written records certain information is found. Because we want to make sure we're seeing the information that's in those documents, but we don't always understand the abbreviations that are used, or
And I'd say even too that that can even be a little rare more recently. We've had a lot where it's okay, what is the role of this person? Are they an RN? Are they a CNA? Are they a tech? Because the records we're looking at just doesn't say what their licensure is, and saying, okay, what is it? And provide documents to back that up.
and then also in our investigation, we consult with our legal counsel as needed. That's the Department of Justice, and they provide us guidance as we're doing our investigations. We have, as we wrap up our investigation, we have an exit conference. Again, that's optional. And that is, again, just answering questions about the process and next steps. We don't provide any information about actual findings during that exit conference, nor are we gathering information. We complete our investigation and we send the report by email. We post the report on our website, healthoregon.org/nurse staffing. And if you go to the website today, you will be able to find all the reports we've done this year so far, and they're already posted. And for investigations that meet statutory criteria, we will issue a notice of warning with hearing rights. It indicates we are going to issue a notice of warning, and you can ask for a hearing on that. And then if there is no hearing request, we will be issuing a default final order saying that the hospital got a warning. That is what we're doing until June of next year. Only beginning in June of next year, 2025, will we be able to assess civil monetary penalties, commonly known as fines. And when that happens, we will again issue a notice of warning. Hey, we're going to impose fines. The hospital then has the opportunity to request a hearing. And if they don't request a hearing, then there will be a default and they will need to pay that fine. I do want to jump back for a second and say, when we complete that investigation, we send that to the original complainant. And then separately, we send it to the hospital administrator, the chief nursing officer, if this is a nurse staffing investigation, the exclusive representative, and the hospital staffing committee co-chairs. When we send any notice of warning, that is sent separately. That is sent not just by email, that's also sent by regular mail. And we send that to the staffing committee. We send it by certified mail to the hospital administrator, and then by regular mail to the staffing committee co-chair, the exclusive representative, and the chief nursing officer. And I just have this is a screenshot of the cover sheet of a nurse staffing report. And so if you go to our website, you'll be able to see they all look like this. They have this kind of cover sheet, and then the next page launches into specific findings for that hospital. And meal and rest break complaints are actually they don't belong to us. Those belong to the Bureau of Labor and Industries. That's the agency responsible for enforcing laws related to meal and rest breaks. So what I'm saying now is my understanding of their practices, but they are the authority on this. Before June 1 of 2025, Meal and rest breaks are subject to the current limitations in Oregon Revised Statute 653-261 and Oregon Administrative Rule 839-020-0050. You can file meal and rest break complaints directly with BOLI, or you can file them indirectly with OHA. If you file it with OHA, we forward it to BOLI. We don't review it for validity, we just forward it directly to BOLI. When we do that, BOLI may still require the complainant to file a BOLI complaint form. So they may reach out to you and say, now you need to fill out the BOLI complaint form. If you file it directly with BOLI, then you aren't filling out our form and their form, you're just filling out their form. So filing with OHA creates a delay in getting your complaint to BOLI.
And then also, like you're mentioning too, it's gonna have a delay in getting it to BOLI, but also BOLI is going to ask you. My understanding is almost all the time they're asking you to fill out a complaint form too. So it is going to also create an extra step for you as well.
Which sounds kind of frustrating.
Yeah.
So now we're going to move on to some tips for success when submitting hospital staffing complaints. First of all, avoid abbreviations. Write out the full name of the unit or service area that is the subject of the complaint. Specify which unit of that type if there's more than one. For example, medical surgical 3. Because we see a whole lot of abbreviations and we don't know every single unit name at every single hospital, and different hospitals have different names for the same kind of service. I will also note that saying all or most of the units is not specific. We need specific unit names.
And granted that with that medical surgical 3 example, do you want to call out our small critical access hospitals? If you say medical surgical and write that out, and you're a 20-bed hospital, we'll know that you've got the one medical surgical. Right. But for our bigger hospitals where you've got a lot of units, you've got a lot of beds, please do specify the floor as well if it's not, or if it's a more common unit like a medical surgical.
If you've got more than one of that kind, specify which one it is. Yeah. Be specific when describing what is required and what went wrong. For example, if you're asked to write what the staffing plan requires, write 1 RN required for every 5 patients on the unit, or an RN cannot be assigned to more than 5 patients at a time. Don't just write 5. We can, as I mentioned before, only investigate the specific complaints listed in the statute. Those were back on page slides 5 and 6. The law includes, as I said, a lot of requirements for the staffing committee operations and staffing plans that are not subject to the complaint process. We don't have the authority to enforce those other requirements. We review whether the unit is staffed as described in the staffing plan. So compliance can only be measured when the terms are adopted in the nurse staffing plan. So contract terms, we can only measure compliance when those contract terms have been put into the staffing plan. Also, the statutory nurse to patient ratios. So that back in the bill, it was called Section 6. That needs to be incorporated into the nurse staffing plan for us to be able to enforce it. And the following things can only be found non-compliant if the nurse staffing plan has specific language prohibiting this conduct. So if the staffing plan specifically states that nurses cannot do total care, then we could find non-compliance. But if the staffing plan is silent on total care, then there's no enforcement action we could take if nurses are being required to do total care. In addition, I know there are a lot of questions about patients not being assigned to a CNA. So you may have a 21-bed unit and 14 patients are assigned to 2 CNAs and 7 more patients are not assigned to a CNA. Unless the staffing plan requires that all patients be assigned to a CNA, we would not be able to take an enforcement action in that situation. So some tips for success, and all of these tips for success are also ways that we look to reduce the follow-up, because when we have to do follow-up before we can even start a complaint investigation, that slows our process down. We're emailing you, we're waiting for a response, we're emailing again. We're trying to get the information to determine if this complaint is valid. But if you give us the right information up front, then we know it's valid and we can get moving. So when a complaint has conflicting allegations, and this is the most common one of these, is a complaint that says the hospital didn't follow the unit's nurse staffing plan and the unit does not have an approved nurse staffing plan. That's a conflict. We can only investigate, we can't say, well, you weren't following the plan that you didn't have. So we need to know which of those allegations it is. Is it that you didn't have a plan or that you weren't following the plan that you did have?
And I think that an area of confusion that a lot of people have related to this is that their unit may have started implementing this new plan. Well, if you're implementing a new plan, that plan is now no longer, well, if you implemented a new plan that wasn't approved by the nurse staffing committee, that's not having an approved plan.
Right.
And so people will sometimes get confused about that and say, well, we're not following our old one because we're implementing this new one. If you're implementing a new one that hasn't been approved, that's an issue of not approving a nurse staffing
Not
plan.
having an approved plan.
Yep.
So any individual can file a complaint, but I would note that when we get duplicate complaints about the same day, same unit, same shift from multiple complainants, that does slow us down because we have to go through each one of those and determine, is it a valid complaint? And then we will investigate it, but we'll investigate it with the other one that's just like it. But it does slow us down. So I would say, if you're talking to other people on your unit and you both know you're filing complaints, maybe consider it's better for us to get one good complaint than to get 2 complaints about the exact same thing.
And along those lines too, in the report, if we had 5 complaints that are the exact same day, the exact same unit, the exact same shift, it's the exact same thing that's getting described. If we have 5 of those, we would investigate all 5 together, but in the report, assuming that we found non-compliance, that's still showing up as one violation for all 5 because it's the same conduct. So just something to keep in mind if, like Anna says, people are wanting to coordinate this.
A complaint about a shift that has not yet occurred, that is not a valid complaint. We would not be able to investigate that. And failure to respond to an email, when we send an email asking for follow-up information, when we need more information, if you don't respond, that slows us down even more and it increases the likelihood that we will not be able to investigate your complaint. We've reached out for more information because we need to know if this is a valid complaint or not.
And just to go back real quickly about those shifts that have not yet occurred, as it relates to those night shifts, it does have a prompt on the form that says for overnight shifts to do the date that the shift started. That way we can try to figure out when did this occur, because with night shifts, the date's going to switch. So just be careful about that if you're filing a complaint about a night shift.
And we do have you identify the shift on our complaint. So if you identify that it starts on the 9th and it's a night shift, we know it's going to go over into the 10th.
Yes.
So with that, we are now going to start answering questions. And we received a lot of questions in advance, and we're also getting questions live.
And I will say we have been checking throughout the week for the pre-registration questions. I saw a lot of people register and ask questions about 15 minutes before this webinar started, which people were welcome to do. We haven't had a chance to go through the ones that were posted 15 minutes before the webinar started. So those, go ahead, put it in the chat. And again, send those to the one that's labeled questions here to our team member, Tip McIntosh. She is here today helping us look at the questions as they come in.
And we will answer as many of these questions as we can. I know we have quite a few already. So I'm just going to pick one and I'll answer and then hand it over to Kimberly to answer the next. So we have a question about, will the complainant receive any information on the status of the complaint submitted? So you get that immediate, your complaint has been submitted. And then the next information you'll get is either a letter saying this was not valid, or you will get the report indicating that the investigation has occurred, and then, explaining what the investigation found.
I see one as well and we talked on this briefly during the presentation, but what staffing plan will OHA look at in an investigation if a hospital has submitted an unapproved plan and the only approved plans that are available are from 2023? So that's two separate issues there. There's one part of it where it's about the submitting the staffing plans and OHA posting those plans on the website. Those are going to be there, but during an investigation, like what we talked about, we need the complaint, or we need the nurse staffing plan that was active at the time that the complaint was approved. So that's what we would be requesting, because let's say that we have a complaint from July 2nd and you update your nurse staffing plan and submit something else July 16th. Well, we would still need the nurse staffing plan that was in effect at the time that the complaint was submitted. So we would be, for any of these complaints, what we're doing is we're looking at the specific dates of alleged non-compliance, and then we're asking for the nurse staffing plans that were in effect on those specific dates.
So we have a question, do we complain when we are short even 1 or 2 staff members down? And what I would say is, it is up to you to decide when to complain. You are the eyes and ears in the hospital. You know when you're following your staffing plan or not, but we are looking for whether you are complying with your staffing plan, with what's written in your staffing plan. And so the direct care staff is really on the front line to determine when to file a complaint based on what's in your staffing plan.
And that's exactly it too. I mean, that's the main key, is that staffing plan, because that's what we're enforcing. So knowing what the required language is in that.
We have a question, what is the process for investigation, especially if there's more than one type of complaint? So I will give an example. We could have a complaint that says not enough RNs on this shift, not enough CNAs on this shift. And we would investigate both of those things and look and see what is the minimum staffing of RNs specified in the plan and what is the minimum staffing of CNAs specified in the plan and how many of each were actually on that shift. I will again note, though, if you say we weren't following the plan and there isn't a plan, we can't investigate both of those at the same time because they contradict each other. So we're going to try to figure out, was there a plan or not? But mostly what we're going to do first is reach out to you and say, which is it? Is it that there wasn't a plan, or is it that there was a plan, but it wasn't being followed?
We've got a question here about our investigation process and what documents are required and what is the formal process involved. That is really going to vary depending on what the specific allegations are related to the complaint that we're doing. Anna showed those slides related to what we can investigate. Several of our investigations have been related to not following a nurse staffing plan. And so for those types of investigations, what we're going to need to know is we'll need to know what nurse staffing plan was in effect at the time of the complaint. So we would need that nurse staffing plan, as well as supporting documentation to show that that nurse staffing plan had been approved. So that's usually going to be the nurse staffing committee meeting minutes and roster. And that way we can determine, was that plan appropriately approved by the nurse staffing committee? So nurse staffing plan documents. We would then also need to see, for that specific date and shift, was the unit following the nurse staffing plan? That's going to have us get into documents like charge logs to see how many nurses were working on the unit, maybe timekeeping records to see when people arrived, and how many people were on the unit at what times. We'll need to know staff member roles. That's usually included in things like charge logs and timekeeping records, but sometimes it's not. And so we'll look at those documents together. And like I said, it's really going to depend too on the underlying allegations.
Okay, I see a question about would OHA fine a hospital if it was found in violation of the stated staffing plan acuity and intensity tools, even if ratios were maintained? And what I would say is we're always going to look to the staffing plan to determine what the staffing should have been. So if the acuity and intensity tools provide specific numbers that then are part of the nurse staffing plan, we can enforce that. But if the staffing plan says these are the minimum ratios, we'll consider acuity and intensity without any additional information about what impact acuity and intensity has in changing specific ratio numbers. We wouldn't be able to enforce it. We're really looking for what are those specific numbers, because that's what we can enforce.
I think the hospitals that have done this successfully that we've seen thus far have had it in their plan sort of exactly like you're saying, Anna, where it's this list of diagnoses or this list of criteria, and this is now going to be a ratio, for example, of 1:3 or 1:2. One of the things to keep in mind is if you do have those other ratios, though OHA is generally not looking at patient records as part of this hospital staffing process. So again, the hospitals that have been successful in this have really been marking on various documents, like the charge log saying, like making a note saying this patient needs a 1:2, this patient needs a 1:1. And the nurse staffing plan, of course, allows that determination to be made. But if it's only a diagnosis in a medical record, that's not necessarily going to be something we're going to see during an investigation.
We have a question: if staffing plans were to omit ratios, would OHA uphold the complaint about breaking the ratio law? And I assume this is referring to RN ratios. And as we've noted, we can only enforce the ratios when they are incorporated into that staffing plan. So the fact that a unit has a staffing plan that has a different ratio, then we're going to go with what's written in that staffing plan. We cannot enforce a ratio that isn't actually incorporated into that staffing plan.
I do want to remind everyone, please do not send the questions to me. Please go ahead and send those to Tip. I'm looking at our list of questions as we're going through it, and I want to make sure that I see your questions. So send them to Tip. Tip's getting them over to us. So here's a process question related to an investigation about how long do we have, how long does OHA have to respond to a hospital submission of requested documents for a complaint? So that's really, there's a few different timelines happening here. OHA has, the statute directs OHA to complete an investigation within 80 days of the start. So our timeline, our clock starts ticking once we send you the notification. The hospital also has a clock that starts ticking at the time that the investigation starts. That's 20 days to get us those required documents. Now, what's going to happen once we get those required documents is really going to vary from one hospital to the next, even one investigation to the next. Because what we need to do is we need to look at those documents. We're going to analyze them, and then we're going to see what questions do we have about this? What additional information do we need to be able to understand the records that are in front of us right now? And so that's really going to vary while keeping in mind the timeline that OHA has for those investigations.
I see a question about how will OHA BOLI process work for missed meals and breaks when they are not covered by a collective bargaining agreement. So our process is the same, whether there's a union in that hospital or not. Our job is to send it on to BOLI. BOLI's process will change somewhat in 2025. Currently, if it is an issue of there is a union, then my understanding is BOLI will refer you back to the union. And if there is no union, then BOLI can investigate it. But that is all within BOLI's jurisdiction. So what I can say is our process before and after June 1 of 2025 is the same. If we get a complaint about meals and breaks, we send it to BOLI. I also see we have some questions about professional technical staffing and services staffing committee requirements and definitions of both service and professional technical staff. I will note we will have a webinar for professional technical staffing and services staffing as we get further into the fall. In terms of the definitions are in the statute indicates that it can be set at each hospital. So those definitions may not be the same across the state. I think we can fully expect that different hospitals will have different people in those two categories.
I've also seen a question in here just about the civil monetary penalties and what happens with those. So again, that's 2025 when that starts. And those funds that are gathered from the civil monetary penalties, my understanding is I believe that goes to the general fund. So it's not going to OHA, it's not going to any employees at OHA, it's not going to the complainant. For the ones that we investigate, BOLI has a different process starting in 2025, but for any of these staffing plan ones, that my understanding is it goes to the general fund.
I see a question, are plans valid if the unit doesn't sign off on it or it doesn't get voted on in the staffing committee? And what we measure is whether it was approved by the staffing committee. We do not have the authority to look at unit approval. So we look at, was it approved at the staffing committee level, the hospital-wide staffing committee?
I see a question here. If our unit does not have a currently approved staffing plan, do we revert to following and filing complaints under our previously approved plan? So I'm not entirely sure what is meant by reverting to an older plan. Hospitals were required to adopt new plans to comply with HB 2697. Some hospitals were early adopters and started doing that in September 2023. Some have started doing that more recently. But if your hospital has not, since September 2023, has not adopted a new plan to align with and comply with HB 2697, then that would be a failure to have a nurse staffing plan, failure to adopt a nurse staffing plan, not, you wouldn't be reverting back to an older plan.
You may be using an older plan, but it could be a valid complaint for failure to adopt a plan that meets the new requirements. We have a question about if you send items that may have patient identifiers, do they need to be blacked out to be HIPAA compliant? And what I would note is if you go through our staffing complaint form, there really isn't anywhere that you could be entering patient information. So that shouldn't be an issue. If you file a patient safety complaint, then we do need that patient information. You can't black it out.
And that's for the filing complaints too.
Yes.
For the hospital, if we request records with patient identifiers on it, hospitals routinely give us that as part of the licensing requirements. And that is information that we sometimes need to do an investigation. So,
and that we have a right to have because we are conducting an investigation.
Yes, HIPAA has a section that allows state licensing agencies to do investigatory. I can't speak today, investigatory work. Thank you.
Who decides who has access to the portal to upload information? So because the hospital is the one who's licensed by us and responsible for compliance, then it's the hospital administration that indicates who will be uploading information through the portal. It's often hospital administrative staff who everyone sends them the information and they upload it to us. And those are they're uploading the information that we have requested.
We have a question of, are you able to say who the complaints are coming from as a percentage, not as an individual, and what group is primarily submitting complaints? I will say this is information that we presented to the Nurse Staffing Advisory Board recently. So there is actually a dashboard on our website that does show this. if I am recalling correctly, I believe the majority tends to be from direct care RNs, although there is also a large number that come from direct care CNAs. And again, that is on our nurse staffing website under the Nurse Staffing Advisory Board meeting schedule. If you look in the July 2024 packet, you will be able to see that.
And I am gonna scroll to that. Oh, it'll take me a while to get there, won't it?
Yeah, we have 1 minute here.
Here we go. So these are the complaint bases. Again, you'll be able to find this on our website and see it. But yeah, you can see how many. Oh, I think it's before this. No, nope, it's after this, isn't it? Okay, this is who's filing the complaints. No, this is type of complaint.
Yes, it
Sorry.
could be the next page, I thought. Nope, maybe page after. That one.
Yes, okay.
So
This
yeah,
is-
what page is that? So that
That is page 20 of 22 in the packet.
yes, so that's on our website. I see a question about, does OHA prioritize investigations or are they conducted in the order of receipt? So that is a complicated question. What's happening here is that we need to determine if a complaint is valid. Once we have determined that a complaint is valid, then we have 30 days to get in. I'd say to get in there. This is done remotely, but my mind always thinks of these as being on site, even though they've been off site. We have 30 days to start our investigation. So we look at these to say, when are we going to need to get out there? Now, if we have a complaint at like hospital A, and hospital A is due like next week, and then there's another one that we just determined was valid and we have 30 days, we're not going to go back to hospital A again. We're just going to bring that newer one with that investigation. We're going to make sure that we can bundle those together. That way we can, and we'll get in sooner on that newer complaint, and we can go back to the hospital less times and just have it bundled into as few investigations as possible. So I'm not sure if I feel like I answered that question without giving a yes or no, but I'm not sure it's a yes or no answer.
I think it isn't really a yes or no. It is we bundle as much as we can for convenience because we are having so many complaints at so many hospitals and often repeat complaints at the same hospital.
And I do want to, highlight that we went from about 30 complaints a month, about that much, from May, or I shouldn't do this backwards, from September 2023 to May 2024, about 30 complaints a month. And then in June, we hit about 30 complaints a day. And it started being much higher, more like 38 complaints a day. We're now down to about 30 complaints a day. So we're having about a month's worth of complaints each day since June 1. And so that's been a lot of complaints for our team to work through.
We have a question. What if a hospital is utilizing LPNs, but they are not mentioned in the staffing plan? We can only enforce the staffing levels that are specified in the staffing plan. And we would expect the staffing plan to include LPNs if LPNs are being used in the hospital. We have a question. Please describe the process for gathering relevant information from the complainant to ensure a fair and unbiased complaint investigation. So most of our information from the complainant needs to come in through that complaint form that's available online. That's where we get the majority of that information. And then because the hospital is the one with the license, we then make them prove to us through their records whether they were compliant or not. And this mirrors very much the federal investigation process as well. When we investigate patient health and safety issues at hospitals, we are using those hospital records and looking at them to determine, did the policies and procedures meet the requirements in statute or federal regulation? Did the practices of the hospital actually align with what was in their policy? We're doing the same thing here, saying, what was your nurse staffing plan? That's your policy. And were you following it?
And I'll note too, the nice thing about these being so heavily document reviews, we spend the majority of these investigations are record reviews. What happens is the information we need are really going to be in these plans and these documents that the hospital is producing as well, for sometimes a lot of times for other business purposes, like the timekeeping records or the charge logs. So these documents that we need already exist, and it does help us get the information that we need for these investigations. And along those lines, I do see a question of what is our process to validate that the plan that is provided for the investigation is an approved plan, so a plan that's been approved by the nurse staffing committee. And that's what I was mentioning earlier as well, where we're looking at the nurse staffing committee meeting minutes to see, because in your meeting minutes, you're writing, this is who was here, this is who voted,
this is the date,
this is the date. Please, with your minutes, include all that information, the date, who voted, and
what their role is on the committee.
That's also very helpful. If we have to sometimes go back and ask that, but please have that in your minutes as well. And then we'll see in the minutes, this was the plan that was approved, or we'll see this plan was not approved, or we're still having discussion on this plan. And when we see that, we see, okay, this plan was not approved. So we have the information we need in there, and we can see, again, you have your equal numbers. The important one, your quorum, that's 50% of the committee plus one. So making sure that all of those things are happening to make sure you have an approved plan.
So the quorum is there to have the meeting.
Yes.
And then the equal numbers are there during the voting.
Yes.
And do you want to talk about the plans on the website versus what we look at in an investigation?
Sure. So those plans on the website, that is what the hospital has submitted as the staffing plans for their hospital. So those are all of the plans for all of the units at that hospital, and we will post that on our website as we're required to do under statute. And those plans, again, we are not validating those plans, as in there's not a process for us to go through and check each one and are they meeting requirements. We are taking these plans and we're posting them on our website. That is a different process than the investigation. The investigation, we need to know what was the plan that was in effect, which is why, as well, it's very helpful if you date your plans, because otherwise we'll come back and we'll ask, do you have minutes? And when was this approved? I mean, we're still looking at the minutes to know when it's approved, but it's nice to have a time range to know how long that plan's been active. So we're checking the nurse staffing plan dates, we're checking our meeting minutes, we're checking the nurse staffing committee roster. We need to know if you had a quorum. And sometimes those minutes will just say who voted and who was present. It won't say how many of the nurse staffing committee is actually there. And so that's another thing we need to check. And so for those investigations, we're going and we're digging quite deep to see, is this an approved plan that was in effect at the time of the complaint? Because if you have 60 days to file a complaint and then we have 30 days to get in there and start, that could be 90 days. We may have already updated that plan and we don't need the new one. We need the one that was in effect at the time of the violation.
And speaking of a sort of related issue, if our hospital submitted plans and they weren't approved by the nurse staffing committee, are they in violation and will they be fined? So again, the fines don't start until incidents occur after June 1 of 2025. And we don't know that a unit doesn't have a plan unless we get a complaint saying there isn't a plan. So just having a hospital send us a staffing plan, we don't know that it has or has not been approved. We don't know whether that is the plan or not. So we rely on those complaints that say we don't have an approved plan, And again, we aren't relying on that plan that's on the website to determine whether that is the plan in use on a given date or not.
We've got one right here of, is it considered a violation of the staffing plan if you're operating off the minimum staffing grid instead of the goal staffing grid? And so that is a great question. OHA can enforce the required staffing levels in the nurse staffing plan. So that's things like the minimum staffing numbers, maximum patient ratios, required staffing levels. Those words that sound more mandatory, those are the ones that we can generally enforce. Things like goal, core, ideal, recommended,
Aspirational.
yes, all of those can be helpful for operating a unit, but it's not going to be something that we can enforce. And I know that there's several hospitals out there that will include those in there and will measure for their nurse staffing committee how often are we meeting the goal or the recommended levels versus the minimum levels, and they'll track that to know what do we need to change. But OHA, we generally cannot enforce that goal, recommended, ideal for staffing level. It's the required, the mandatory, the minimum, maximum ratio. That's the enforceable stuff.
We have a question. Can you share BOLI complaint actions like you share OHA actions? We do not actually have any information about what happens after we send a complaint to BOLI. That is within their jurisdiction and not ours. I don't know what, if any, process they have for making that information public, but we don't have access to that information.
Yes, so if you have questions about the status of something with BOLI, we're not going to know what it is. And their contact information, I believe we have that on our website. We definitely have the link, so they'll be able to help you with any of your BOLI questions. Like Anna says, that's not information that we're going to have. And I do want to flag for people, we're already at 11 o'clock. This goes by really fast.
We will stay on for a bit longer and keep answering questions. We do understand that some people may need to drop off. And again, we are recording this and we will put it on our website within the next couple of weeks. We had a question about if there is a known nurse shortage when a complaint is made, do we still need to show reasonable efforts to recruit? And that actually goes into a specific area of the law that is, if there is non-compliance, the hospital has certain actions it can take. And if they did all of those actions, they could not be fined. They would get a warning. And so it's things like working with a staffing agency and trying to get coverage for that shift. And what are some of the other actions in the
19.4?
In the 19.4.
I should really memorize the statute and not the bill for that one, but 19.4 just stands out to me. So the arranging coverage, the temporary staff, and there's 5 things. And the volunteers, like
asking for volunteers. So the hospital would need to do all of those things to avoid a fine when there is that non-compliance, but that is a voluntary process by the hospital. So the hospital can choose whether or not to take those actions. And what we would say is the hospital would, according to the statute, the hospital would need to do all of those things in order to avoid a fine if they choose to do so.
We have a question here that says, if a complaint is made regarding unsafe staffing levels from a unit that does not have an approved staffing plan since September 2023, is the complaint found invalid? And what's going on here is, I do want to point out there is a difference between valid and invalid, as well as substantiated versus unsubstantiated. So that first pass, that very first thing we're checking is, can we investigate this complaint? So let's say we have someone who genuinely believes they have a staffing plan and they've got the staffing levels. They're not sure when was last approved. And so they submit a complaint about it and they give us the information we need that says something like we needed 9 RNs, we had 7. That would be a valid complaint. We would say, okay, this is an allegation that we can investigate. We can go in and investigate. While we're there, we would see during the investigation, we would see this nurse staffing plan hasn't been approved. The complaint is not substantiated, but there is a violation with it. We're going to cite the hospital for failure to adopt a plan. So that complaint would still be valid. We still did an investigation, and we can only investigate valid complaints. But it then comes down to that second pass of substantiated, where are the things alleged found to be true versus unsubstantiated, where that noncompliance, that specific type of noncompliance alleged is or is not found. Again, in that specific example, we would have found that it wasn't that they weren't following the staffing plan, it was that they didn't have a staffing plan. So the specific allegation wouldn't be true, but there would still be that violation for not having a staffing plan. That, I know that's a little complex, so I hope I hope everyone followed that, but just remember the 2 passes.
And I saw we have a question about who is responsible for ensuring breaks and lunches and staying within ratios? The hospital has the license. The hospital has to ensure that the units comply with the staffing plans. And that includes ensuring that minimums are maintained during breaks and also that staff members get those meal and rest breaks. We also have a question, why will the med-surg staffing ratios go from 1 to 5 to 1 to 4? I believe that's in June of 2026 that change will happen. And that's because that's in the statute that will occur. That is, OHA doesn't have any jurisdiction over when that occurs or why that occurs. That is part of the statute.
And again, a reminder that we are enforcing the staffing level that you have in your approved nurse staffing plan.
We had again, I'm going to say professional technical staffing is going to be covered in a webinar in the fall along with service staffing, but we did have a question, do ratios apply to the professional technical staff members? And again, that's going to depend on what's in that professional technical staffing plan. There are no ratios in the law for professional technical staff members, but the staffing plan can set ratios, and that's going to be whatever is approved by that staffing committee.
So on that dashboard that we have, it does show that it does show our timelines and how often we're meeting that 30 days and how often, like that 30 days to start an investigation and how often we're meeting the 80 days to complete an investigation. We have a question related to that, asking when we're taking longer than 80 days, whether the hospital needs to reach out to us to ask for an update. You're certainly welcome to, but know that it hasn't fallen off our radar. We are working through these as quickly and efficiently as we can. We have currently, I think, about 313 complaints that are under active investigation. So we're doing what we can to get all of these out to you as quickly as we can.
We had a question, how quickly are you able to work through complaints on average? And I think it really depends. One complaint may have multiple allegations, and if we have to do follow-up to try to determine what the complaint really is about, then that will slow it down.
And those nurse staffing plans too. Sometimes for nurse staffing plans, we've seen that's a much faster process because we've seen the plan, we know how to work through it. And then it's very important. We talked about this more in our last webinar about the the language in the nurse staffing plans, and that previous webinar is posted on our website. But the language in the nurse staffing plans that help us know what's the enforceable required staffing level versus words that we aren't able to enforce, that can sometimes take quite a bit of analysis, especially if those two words start getting meshed together. Like if we see things like minimum recommendation, that can be a lot more complicated and require us to look through a lot more of the body of the plan, trying to see supporting evidence for, is that a recommendation or is that a required staffing level? So being very, very clear in these staffing plans is important, and the clearer the staffing plan, the easier it is to analyze it and get that investigation done quickly. And so I know that we talked about this a little bit earlier. We do have a question as well about how are staff RNs included in the investigatory process. We do have, what we're doing is when that complaint is submitted, if we need additional information to clarify any of the allegations in the complaint, that's when we're going to reach out to the complainant to get more information. But generally speaking, when a complaint is submitted, we have the information we need to know whether to do a complaint investigation. Once we start that investigation, it is almost entirely going to be record reviews. And we're going to look at, like I said, timekeeping, nurse staffing plan, committee meeting minutes, and quorum. And so there's really not a lot of interviews for either direct care or nurse managers, where really we are looking at these documents, and while we might need clarification on, is this person an RN, are they a CNA? Or we might say, hey, we need additional documents. We're really not having to do a whole lot of investigate or interviews.
So while you're on that topic, can you talk about maintaining the integrity of the investigation when communicating with nurse manager, co-chair, and direct care co-chair?
Yes, so the nurse manager co-chair and the direct care co-chair are both given that that investigation notice that we mentioned earlier. That's going to include the week of the complaint as well as the complaint allegation type that we're looking at, not the specific allegations themselves, just the general category, like RN staffing levels in the nurse staffing plan or CNA staffing levels in the nurse staffing plan. So that general category. It goes to both co-chairs, the nurse manager co-chair and the direct care co-chair. And both of those co-chairs also get an invitation to that entrance conference. That entrance conference, like we mentioned earlier, isn't going to be an interview. That's really just us clarifying any documents that we need and giving timelines, as well as knowing who's going to be uploading to our secure portal. Both co-chairs get all of that information.
And I want to add to that, under the old law, when we did the triennial survey, so the survey once every 3 years, we were required by the law to interview both the direct care co-chair and the nurse manager co-chair. That was always part of the survey. It was in the law. We had to do that. When we did a complaint investigation, that interview was not required, and it generally didn't occur because those two individuals didn't have direct knowledge of the facts underlying the complaint. So we would only interview them if they actually had personal knowledge about that. Now we are complaint driven, so we don't do any triennial surveys. And so we don't, as a matter of course, interview the co-chairs when we're doing that investigation.
There's an analogy that I've used for our team that I really like where, those, and I'm forgetting what it's called, right, when I'm giving the analogy, but those things that when you're at the beach and you're looking for metal and
Metal detectors.
of course, that's the word. Those metal detectors at the beach, that's what the survey's like. We know which beach to go to. We've got our metal detector. And then if we'd get a beep, we would go dig deeper. And so interviews were very helpful for that triennial survey process under the old law. Nowadays, when we're doing these complaint investigations, it's like we've got a treasure map and we have the X on the spot. We know exactly where to go. We know exactly how far we're going to need to dig, where to dig. So we already know where we're going to need to look. So those interviews were extremely helpful when we were casting that broader net for us to know how deep are we going to dig and where, because we're not going to be able to dig up the entire beach. We need to know which specific spots. Now we have our treasure map that tells us exactly where to go, when, and where.
And with that, I think we will take one more question.
Okay. While we are looking for our last question, I will mention the nurse staffing mailbox. If you had a question that you wanted answered and it was not answered, we will put that mailbox address in there and a member of our team will reach out to you. So go ahead and send a question there if you had a question that didn't get answered.
And we have a question, clarify where the rules governing mandatory overtime live and if the change to the law changed that. It did change where they live. They now live in Oregon they're in statute. That changed because the statutes all got moved around. And I can tell you where that is. And also it changed in the rules because all of the nurse staffing and hospital staffing rules moved to a new division within the administrative rules. Originally, they were in 501 and 510. Now all hospital staffing rules are in division 503. So that's chapter 333, 503. And that's where the overtime rules live now in the rules. And then in the statute, the mandatory overtime was previously in 441-166. It is now in 441-770. And that's where you will find all of the mandatory overtime statutory requirements. And I think actually the rules went away.
Yeah.
Because we don't have
yes, we don't necessarily have rulemaking authority for those.
Yeah.
What I will mention, I know we said last question, but we had one last question come through that I feel would be great to answer now, in part because it allows me to highlight how amazing our surveyors are. It asked, what does the OHA staff look like? What does our team look like who's doing those 313 active investigations? We have our admin support specialist, Tip. She's helping us run this meeting, and she is our one admin support who's helping us get things entered into our database for those 1,000-some complaints that we have gotten. We have our surveyors here. We have one surveyor who is completely fully trained, Austin Schmidt. They are wonderful. You may also get to interact with 2 other surveyors who are currently training, Terry Ann Stofield and Christine Kingstadt-Deagle. They're both new, they're still training, but we have this team of 1 fully trained surveyor and 2 surveyors in training who are handling all of this, and they are doing a fantastic job. So wanted that to be the last question so I could just highlight the fantastic work they're doing.
And I will say we are also hiring additional surveyors, compliance specialists, operations and policy analysts, and admin staff so that we can have more staff to do this work. And I will stand corrected. We do still have an overtime rule. That is OAR 333-503-0060. And with that, we will wrap up and thank you for the great questions. And also know that some of these questions we will end up including in our FAQ. And we did recently update that FAQ, so keep an eye on that because we will have further updates there.